What's your first name? Nice to see you. Hey, Ralph Northam, nice to see you. What's your first name? I remember that's my wife's name. All right, so we got another fan, that's good. Thank you all for being patient. They have what they call transportation issues. And they have these things.
Well, now you know that all changed. The 600 needs to be widened, right?
They have these things called tunnels.
Oh, yeah.
Why should everybody slows down?
I don't know. I've been wondering that myself. So welcome. I'm so glad that I to participate in this. I'm excited to be a part of it. I'm excited to see the activism and the energy in the community, and very excited that the candidates are donating their time to getting to know the community and their constituents and caring about our issues and concerns. So for this portion, we're having a roundtable. In order to facilitate the substantive topics of that roundtable, we're going to quickly go around and just introduce ourselves with a line or two so that we can quickly move on to the give and take of the roundtable, okay? So we'll start off, of course, he just introduced himself, but we'll allow our candidate here to do so, and we'll go that way.
All right, so I'm Ralph Northam. I hail from the eastern shore of Virginia, and Pam and I live in Norfolk now. People actually ask me now where do I live. I tell them in the car. I don't travel around too much, but I was in the Senate for 6 years, and then I've been lieutenant governor for 4, and now, as you know, running for governor. But thank you all for being here. This is, I'm a physician by trade, and I actually have an office in Newport News. So I've seen a lot of patients. I'm glad to be at TAB. I always ask you where they go to school, and a lot of them go to TAB, but it's nice to be at TAB. So anyway, we doctors tend to like to listen, and I appreciate being here and having the opportunity to listen to you all this afternoon. So it means a lot for you all to take time out of your busy schedule. So thank you.
I'm Chris Mayer, chair of the Poquoson Democratic Committee.
I'm Sam. I'm a sophomore at CNU, and I'm also the president of College Democrats there
Good
as
for
well.
you. What a great campus.
Thank you very much. We think so too.
I'm Lauren Fury, and I'm the vice chair of Peninsula Voices for Change. I also work at the Mariners Museum, and so that's what I do.
I'm Nancy Hummel, and I'm with the Poquoson Democrats.
Good for you.
My name is Shazia Amir. I'm with the PICC, the Peninsula Islamic Community Center.
Yes.
I'm the treasurer, and I am coming on behalf of the Muslim community. And my husband actually interned under you when he was in residency, and he is so happy that you are running today.
Please tell him I said hi, and thanks for being here.
I'm Kathy Strock, longtime resident of Newport News. I am with the Democratic City Committee of Newport News and also with the Peninsula Voices for Change and Peninsula Indivisible. Newly retired and have time on my hands to do this.
All right, thanks for being here.
Oh, I don't want to go after you. So my name is Pam Mason. I'm a resident in York County, and I'm an environmental scientist by trade.
I'm Lisa Laurier, and I'm actually here. I'm with the Middle Peninsula group too, and I'm here to discuss women's issues.
Okay.
I'm Cassie Jacobs. I'm CEO of Peninsula Voices for Change. I also have a double master's in clinical psych and social work, so I too work in the medical field, and so my questions are going to revolve around substance use.
Okay, good.
I'm Mark Schmidt. I'm an attorney, and I'm a member of Peninsula Voices for Change.
Good for you.
Hi, I'm Lance Jones. I'm employed with Hampton Department of Social Services. I'm a grassroots activist, and I'm representing the African American community.
Thank you for being here.
I'm Pam Couchot. I'm a member of the Peninsula Indivisible and also Peninsula Voices for Change. And I've been a political activist almost all my life.
Good.
And I hate what we have right now in our federal government.
Well, there's some of it in state government as
Oh,
well.
I'm aware too. I've lobbied up to the General
We
Assembly.
can talk about that.
And let's go back to Aiden real quick.
Sure, sorry for being late. I am Aiden Barnes. I'm here representing Peninsula Indivisible and the Southeastern Virginia Skeptics and the Tidewater Atheist Group in support of science, many things.
Okay, good. Thank you.
Good. Well, I was not given a particular order for which to start the questions, right? But unless someone knows of different directions. Okay, good. Then I will take volunteers. And in order to make sure everyone gets at least one question off, let's try to limit the time it takes to ask the question as best as you can. And That too, well, I'll just kick you, Ralph. No, I'm just kidding. All right, so, who wants to begin? All right, let's go, Nancy.
If you become the governor,
Yes.
how will you deal with President Trump?
That is a great question, and, let me just tell you to start off with that as we travel around Virginia, there's a tremendous amount of enthusiasm and energy, just like in this room, and I suspect what we're getting ready to see in another hour, and we have to ask ourselves the question, what are we seeing out there? Why is that? And I think what we're seeing is an election, a campaign that was run in 16 on hatred and bigotry and discrimination and fear and a lot of misinformation. And people are standing up and saying, this is not the new normal that I'm going to accept. It's not the country that I love. It's not the Commonwealth of Virginia. And so our job, and I'll just be upfront with you, our job this year is to harness this energy and take it to the polls, connect the dots and take it to the polls on Election Day. And not only do we have a chance to win the governor's race, attorney general, and lieutenant governor, which are very important, but we have a wonderful chance of picking up delegate seats. And so we need to get back on offense and stop playing defense. So how do we stand up to Mr. Trump? We let him know, and as you have probably heard me say before, and this is somewhat of a neurological diagnosis, I'm a pediatric neurologist, he's a narcissistic maniac. And he is dangerous for this country. He doesn't understand health care. He doesn't understand the environmental issues. He doesn't understand what it means to be inclusive, that we need to welcome people to Virginia. So we need, as a group, need to make sure that we tell Mr. Trump and everybody else in Washington that what you're doing there is unacceptable to us, and we're not going to let that come across the Potomac River. So we've got to be very strong. So we need a leader that will not only stand up to President Trump and his ways, we also need a leader that understands Virginia and is ready to take Virginia to the next level. So there's a tremendous amount of energy out there right now. And again, he's gotten the message. It started the day after his inauguration when we went up there and marched in Washington. That's the way you tell him, no, we're not interested in your agenda. And so it takes all of us. It takes powers in numbers. It takes our voices to let him know that we're not going to tolerate that. And so that's why there's so much focus on Virginia this year. There are 2 gubernatorial races. That's all there are across this country, New Jersey and Virginia. The race in New Jersey is pretty much already determined. So Virginia's going to be the bellwether. People all over this country, and to that matter, in this world, are looking at Virginia and saying, what direction are you going in? And so that's why it's so important for us to be involved right now. So that's what we plan to do.
No, that's absolutely correct. So, coming from out of state, I can tell you as a political scientist that I was watching Virginia politics for the entire time I lived in Oregon and in Georgia. And outside of the state, the Virginia gubernatorial election is always seen as a referendum on the previous year's presidential election, and this year particularly. So, okay, next question, Cassie.
So I'm just going to mention some of these numbers, although I hope that you're aware of them, Dr. Northam. So fatal heroin overdoses in Virginia rose more than 600% from 2010 to 2015. So my question is about preventative measures. I know that you've really stood for measures that are post-health, but I want to know more about preventative measures. I am the chair of the Alliance for Healthcare for Hampton, Newport News, CSP, but they see 9,000 patients a quarter. So my question is, if you become governor, how can you create statewide programming to assist adolescents and adults who are struggling with substance abuse, because what we have right now isn't working?
Yeah, let me try to put things, I appreciate the question, let me put things in perspective a little bit, and as you know, I'm a physician, and so this is a real challenge that I see, and probably if we asked Virginia what is the largest challenge we have right now, it's the opioid crisis.
Yes.
And so last year, just so you all know, we lost 806 Virginians to opioid overdose. This year we've lost over 1,000. That's more deaths than will be caused by motor vehicle accidents. That's something that we should all find as unacceptable. So how do we deal with that? And I've been going around Virginia, and we've been having focus groups. And I'm a listener, and I want to tell you what we're doing, but I don't have all the answers. But first of all, it starts with people like me, who have pens in their hands and prescribe narcotics, or the ability to prescribe narcotics. And let's say a patient comes in, and I'm trained to keep people comfortable. You've seen the little smiley faces. Are you in pain today? And on the left is, everything's lovely, and on the right, frowning and crying. And so our knee-jerk response, the way we're trained, is to keep people comfortable, and that is to give them a prescription. Here's some pills that will make you feel better. Well, we as providers need to rethink, first of all, the way that we're treating both acute and chronic pain. So I teach at the medical school. I have been working with medical schools where we teach providers such as medical students, physician assistants, nurse practitioners to say, you know what, there are other ways to treat chronic pain. So that's one thing. The second area is dealing with law enforcement. We have far too many people that end up in our jails and prisons because of narcotics. And when we talk to people, especially, and I'll be blunt with you, when we talk to Republicans in Richmond, people see drug addicts, narcotics abusers as bad people. Why should we help them? Why should we give them access to naloxone to reverse the deadly side effects? Why should we make sure that they have clean needles? Why should we put more money in our CSBs so now people have same-day access to CSBs? So this year we at least were able to put in the budget and get $30 million that goes toward mental health care, and a lot of that is going toward the opioid crisis problem. And then the last thing that that we have done is given a blanket prescription, as you probably know, across the Commonwealth for naloxone. And now someone, if have a friend or a family member or a neighbor that is at risk for overdosing, they can walk into any pharmacy that's participating in that program, and most of the larger pharmacies are, and say, I would like a dose of naloxone without any prescription, without any questions answered. And so why is that important? So it starts with prescription medications, and then individuals don't have access to that. They may come back to me and say, Northam, I need another prescription. And I said, well, I don't think it's a good idea. I'm not going to give you another prescription. And then they turn to heroin. And heroin is very accessible on the streets. And heroin is now being laced with fentanyl, which is a very strong narcotic, and also what's called carfentanil, which is 100 times more potent than fentanyl, and it's used, believe it or not, in veterinarian clinics to anesthetize large animals such as horses and elephants. So anyway, we have put in this blanket prescription for naloxone to help those individuals. And then finally, I think it's incumbent on all of us just to let people know out there, and we've been trying to do this at the state level, that if you need help, we're here to help you. We know it's a challenge, but there's help for you out there. And that, for example, to get into the CSB on the same day and get the treatment you need. So that's a long-winded answer to your question, but those are a lot of the things that we're working on. But Governor McCullough and our Attorney General and I have been working on that, but we still have work to do.
I saw Shazia's hand first, and then I'll come around to you two.
Okay. I raised my hand because my question was an offset of Ms. Nancy's question. So to keep with the flow, I raised my hand. For me, human nature, by default, we fear things. And that is how Trump won his election, by fear-mongering, by evoking the fear in people. But he did not realize that fear gives ammunition to terrorists. All right? And that can start at a very young age, because after he's become president, there's been immense bullying at the school system. For a child that's been bullied, who feels outcast, this child, when they feel that torment, can get pushed into terrorism. So he's saying that he's fighting terrorism, but he's not, because he's pushing people away who will then in turn follow radical policies because they feel alienated. And this is very, very dangerous.
Yeah.
And I'm all for you. You have my vote. And we are willing to help with your campaign, any means possible to fight Trump. And so we are a nation that's based on immigration. And we're all here, children of immigrants. None of us, if you go back far enough, were ever here. So the vast majority of people who've come here are here because they want a better life and they love America and they want to stay here. I wanted to know, as governor, how would you promote programs for tolerance and understanding for all races and immigration? Because education is the key.
I agree.
Education is the key. And also, how would you, in particular, help programs for refugees? Because they are the newest kind of refugees, and when they come here, I have seen firsthand, they have limited English skills, they have limited finances, they want to work, but they're limited at so many fronts, and when they go to jobs because of their limited English, or because they look different, because they eat different, they're unable to follow the American dream, which is easier for other people because they look similar.
You are very articulate, and you communicate very well, and I appreciate the question. Let me tell you the first observation I would make, and you may hear this again tonight, but I hold a lot of babies in my arms, and when you look at a baby, you see innocence and joy and affection. So you have to ask yourself, where does the hatred and the bigotry come from? People aren't born like that, are they? So they learn that from someone, and they learn it from people like their parents sometimes, and they learn it from people like President Trump, to be quite frank. I mean, he went around this country and scared people and told them that they needed to be upset, that things weren't going well, and that he was going to make them great again. He won the election on 4 words, make America great again. So then he presented the executive order, the travel ban. And what that did was just provoke fear in a lot of people across this country. So what Terry McAuliffe and Mark Herring and I and Tom Perrell and a lot of people did is we went to Dulles Airport and said that, we are a country, we're a state of inclusivity. We welcome everybody. We want to level the playing field. That's really what we're asking for. People aren't asking for anything in addition. They just want a level playing field. But we went to Dulles Airport for the immigrants that were coming in to say, we're here for you. We're going to make sure if there are any legal questions that these are cleared up. We had a whole cadre of lawyers that were there with us. So that's one thing. The other thing that I would say is whether it be for immigrants, whether it be for the discrimination that we still see against the LGBT community, whether it's the discrimination against people of color, people of minorities, or whether it be the discrimination of someone because they practice a different religion, we can't be like that. That is not what this country is about. And so what we need to do, and what a leader needs to do, is let people across Virginia, in this case, know that we are an open state, that we welcome immigrants, we welcome people who are LGBT, we welcome minorities. Our doors are open, our lights are on. That's the picture that we need to present. And we had legislation this year. I just finished another session. We just had veto session, and there was a piece of legislation to make sanctuary cities unlawful. We don't have any sanctuary cities. These are all things to make people fearful. And again, this was a bill that the Republicans passed, and I broke the tie on that, and I was proud to do that. So again, I think the leader of Virginia, the governor, has to be an ambassador. He has to make sure that people are comfortable and that people shouldn't be living in fear. And the last thing I would tell you is that I think the federal government has to be very careful. They've come very close, if not gone past the line of where their authority is with ICE and how they're going and picking up immigrants. And so the Attorney General and the Governor have been very cognizant and watching very closely to make sure that the federal government is not overstepping their limits and making sure that we treat people fairly in Virginia.
Thank you so much.
Yes.
Okay, so it's going to be Lisa, Lance, Sam, and then Warren.
Okay.
So you see, this is just like presiding over the Senate.
It really is. You don't say, huh? You get a gavel though, right?
That's right.
The United States spends more money in healthcare than any other nation, yet in length of life we rank 43. There's a ton of countries, well, there's 42 countries that have longer lives than we do. That's due to a lot of reasons.
You're right.
Part of it is socioeconomic. Part of it is education levels. Part of it is access to health care. Only 10% of it is due to genetics. And what I want to know is what you're going to do if the ACA is dismantled. I wouldn't say overturned, but let's just say dismantled piece by piece. in order to assure that Virginians have access to health care, especially women, because they had so many services under the ACA available to them. Contraception was free, yearly exams, pap tests, mammograms, all these things that affect women.
How long do we have?
About 2.5 minutes.
No, thank you. First of all, I want to make the point that whether it be health care or whether it be the issue that you just talked about or any of these issues, we try to work with people in Richmond, but sometimes you can't change their minds. So when we can't change minds, we have to change our seats. That's what this whole process is about. That's why we have to go to the polls on election day. So keep that as the big picture. The Affordable Care Act, I will just tell you as a doctor, there's some very good things about it. No more pre-existing conditions, being able to keep our children on our policy till they're 26. The emphasis, as you just said, on access to women's reproductive health care, the emphasis on access to mental health care, the emphasis on access to preventive care. All of these things are good. And so what they did in Congress for the last 7.5 years, they told us they were going to repeal and replace the Affordable Care Act. They put in 53 pieces of legislation over the last 7 years that said to repeal the Affordable Care Act. And finally, when they have the majority in the Senate, in the House, and the President, what they put on the table was an embarrassment. It was pitiful. So it tells us they don't care about us. They don't care about people that need access to health care. They care about playing politics. So I think the Affordable Care Act is here to stay, at least for a while. And so one of the things that we can do, I apologize for keep pointing at you, I'll stop doing that. One of the things that we can do is expand Medicaid. And that is something that we have been fighting for the last 4 years. There are 400,000 working Virginians who don't have access to coverage, and they're working. I would underline the word working. And also every day that we don't expand Medicaid, we're giving to other states who we compete with over $5 million a day. We've given over $10 billion a day that could be used for a lot of the things that you were just talking about. Finally, what I would just tell you is that there are 3 pillars to health care. One is quality, and we have fairly good quality. The second is access. More people need access to a provider so that they can have preventive care. But the third is the cost issue, and it's how are we going to address cost. And so there are a lot of ways to do that, and I'm not going to trespass on your time too much, but one of the ways is that end-of-life care, and I do a lot of hospice work for pediatrics. About a quarter of our expenditures are spent in the last few weeks of someone's life, so we should all have advanced directives. Nobody wants to be hooked up to tubes and catheters and machines. So that's a decision that we all need to make and let the providers know what we want to do in the event something like that would happen. But the other thing is that a lot of our resources, if you look at where our resources are being spent, they're being spent for things like cancer, type 2 diabetes, cardiovascular disease, COPD, all the things that are preventable. Thank you. So we need to shift our focus of resources from things that we treat that are preventable to going back and preventing. And so that's why preventive care is important. Education, early childhood education, teaching our children good habits, staying away from cigarettes, staying away from drugs, eating healthy food. All of these things are tied in, but it's where our resources are being focused. And so, again, that's why we need people that understand health care at the table.
There's a lot of ancillary programs that feed into all that prevention. Programs, state-funded programs like Resource Mothers and things like that work on the prevention model. And that's the first thing that always gets cut. So we have a lot to do to change attitudes about prevention.
So it goes back, remember what I told you first?
Yes.
We need to change seats.
Yes.
And so we need like-minded people making policy decisions that we can work with.
Okay, very good. All
Thank
right,
you.
Nancy.
Although rates of drug use and selling are comparable across the racial lines, people of color, especially young African American males, are far more likely to be stopped, searched, arrested, prosecuted, convicted, and incarcerated for drug law violations. Then what is your position on the decriminalization of marijuana in Virginia?
Lance, man, you are preaching to the choir, and I thank you for the question. So I've been talking about this, and we rolled out a criminal justice reform plan a few weeks ago, and I'm gonna come full circle here. But right now, Virginia, your tax money pays $67 million a year to enforce marijuana laws. Okay, think about it, $67 million. People of your color are 2.8 times more likely to be picked up and arrested for smoking marijuana, put in jail, and end up in the court system. People of color don't smoke more marijuana than other people do, but they're targeted. So what we need to do is look at a lot of things on criminal justice reform, but and we can talk about some of those other things as well, but we need to, I think, decriminalize marijuana. Again, we need to keep people out of our courts, keep people out of our jails. And the other reason it's important, and it comes full circle here, is as a physician, there are many potential medicinal uses for marijuana. And the reason that we can't use it right now is the way it's classified. And so I'd like to make the point to people that over 100 medicines that I use on a daily basis come from plants. So why are we being so short-sighted? So things like post-traumatic stress disorder, things like chronic pain, things like multiple sclerosis, things like the opioid crisis, all of these things potentially could be helped if we were more open-minded to the medicinal uses of marijuana. So part of our plan is to decriminalize that. And finally, I would just say my father and grandfather were both judges. My father's now 92. He still thinks fairly clearly. He has been telling me for years, why are you all just chasing your tails and putting all these people into the court system and into our jails for something that's really not causing a large problem. So I'm all over. I'm all about decriminalizing marijuana. Again, I don't want to beat a dead horse, but we need to change some of these seats out there.
I'm going to pull moderator privilege here and ask you to clarify one point. Are you also in favor of legalization of marijuana for recreational use?
It's a good question, and we're probably going to get there, but not things in Virginia happen in slow steps. I have a little bit of a unique position being a pediatrician. I really can't go out there and encourage, I certainly don't encourage our youth to smoke. I don't encourage them to drink alcohol. I don't encourage them, or condone, I would say, the use of drugs. So I'm not quite in a position as a pediatrician where I say to legalize marijuana, but I will tell you I'm open-minded, and I think we need to look at states like Colorado who have done that. And at the end of the day, I suspect I'll come full circle on it. So that's,
yeah, it's about the revenue, right? I mean, you can legalize pot and dedicate the revenue stream to free higher education in the whole state. One of those things.
We have an attorney here. I guess just do a quick poll. Raise your hand. Who's in favor of totally legalizing marijuana? All right. Well, I see where we're going.
And dedicating the revenue to at least some kind of
Okay.
that's what the state of Georgia did with their lottery, conservative state, and so they sold the electorate on, look, we'll do the sinful lottery, we'll dedicate it, and every student that graduates with a good grade average in the state of Georgia is guaranteed free tuition, or at least mostly free tuition at a public university, and it has done wonders for that state, and I'll be happy to talk to you more about that.
Well, let's make a
anytime.
deal here right now.
Yeah.
Let's say if you're over 18. Is that fair?
Yeah.
So, okay.
Oh, yeah, 21, I would say. 21.
Let's go with 18.
Okay, let's do it. Why not? All right, so I'm sorry. I'm going to go to Sam, and then it was Lauren, and then we'll go to, I saw Pam, and then Aiden.
Thank you. So I really do believe that this upcoming generation is going to be the generation that's tasked with making a lot of key decisions pertaining to the different things going on right now. But especially as my time with President of College Democrats, I've noticed that a lot of younger people don't really know how to get involved in politics, or they don't really understand where to start.
Right.
So how would you as governor work to promote political activism and awareness in younger generations?
Thank you for the question. And Pam and I have two children. One is 28 and one is 26, and they are a lot lot more active at their age than I was, but to your point, it's your future. I'm getting, you see the gray, they're getting ready to put me out in the pasture, but it's about your future and your children, and you do need to be active, and these elections do have tremendous consequences. So we travel around and stop into campuses and have focus groups, and we have, as you know, the YDs. Alexis Rogers, who works in my lieutenant governor's office, is I think the vice president now is her current position. But it's all about reaching out and listening and registering young people to vote and encouraging them to get to the polls on election day. And to your point, you know, if you look historically, especially in an election after a presidential year, young people don't vote, especially in primaries. And so we need to get everybody voting in primaries. And I think that one of the ways that we really have worked hard on reaching out to people like you, and I don't know if you follow us on Facebook or Twitter. Yeah. All right. So, but a lot of millennials, they receive their information through social media, through the digital networks, and so we've really ramped that up and worked hard to be able to communicate in that way. So if you have other ideas about how we can get people your age interested and involved and willing to participate, and you know, to come into phone banks, we accept volunteers and they come in and help us make phone calls and knock on doors, and you know, so all of those things are so important. And we've I don't know how many people we've got volunteering. You actually Niggas, you might know, but
I don't know off the top of my head how many active volunteers we have right now, but I know that it has been, certainly having been the organizer on the Peninsula last year, it has been, and Kathy was one of my first phone bank captains. The energy has been extraordinary this year.
That's great.
But I would just keep encouraging people and just tell them, look, this is about your future, and if you want people like Mr. Trump to continue to lead this country, we need to get involved.
Thank you.
And thank you for being here.
Thank you.
As a member of the tourism industry and also as a lesbian, what you plan on doing to support legislation for equality for the LGBTQ community, instead of us always hoping for a Democrat leadership that can veto. The state is wasting huge amounts of money and resources constantly coming up with this ridiculous legislation. Currently, I can still be fired in the state of Virginia for being a lesbian. So, so I'd like to know what your thoughts are.
We just vetoed our 111th piece of legislation. That's 111 pieces of what I call trash legislation that, if not for a Democratic governor, it would become law. And these are not new ideas that people in Virginia have. They use the same playbook all over the country. And so the very same or very similar law to HB 2 was presented and passed and then vetoed by our governor. So the answer to your question is that, and I hate to go back and say, because I've said it 5 times now, but we need like-minded people in these seats. And that's really, you know, the only thing right now. We have a great opportunity to do that this year, but again, to the points I made earlier, Virginia is inclusive. And let me just tell you, I was down in Salem, and I welcomed the NCAA soccer tournament there. And the reason it came to Salem was because it was supposed to be in North Carolina. And they said, no, we're not going to have it there. We're not going to have the NBA All-Star game. Millions, actually billions of dollars have left North Carolina because of that discriminatory type of legislation. So, again, I think we need to make sure that we continue to be inclusive, and not just for sexual orientation, but for religions, for nationalities, for the color of your skin. And the last thing I would say is that, you know, Terry and I travel all over the globe, really, to talk to businesses about coming to Virginia. One of the first questions they ask is, where is Virginia on inclusivity? Because we live in a very diverse society, and look around this room. I mean, that ought to give you a message. And so we're very proud in Virginia to say that we're not like North Carolina, and as long as we continue to elect Democrats, we're not going to ever be like North Carolina. Our doors are going to be open, our lights are on, and that's the message that we move forward and take forward, because that's very important. it's very important to people that live here morally, and it's also very important from an economic position. So, again, we need to change these seats. So let's have a new theme for tonight, right?
Now, do you have a plan to campaign with these House delegate challengers, especially the ones that are maybe a little less obvious a competitive race?
Yeah, I do, and thank you for that question. We're going to run a very strong coordinated campaign this year, and we have encouraged and recruited a lot of good people to run for these seats, and we need to support them, even though some of them are in difficult districts because of the gerrymander, but we need to make sure that we help them with their websites. We need to make sure that we help them with their outreach, with their finances, etc. So, yes, the answer to your question is we will be very focused on a coordinated campaign. And what that does, and I mean the math is simple, is if you have let's say a Republican delegate that's unchallenged, the turnout in that area is not going to be that good because there's nobody for the Democrats to come out and work for and vote for. So I can help support delegates who are running, and in turn that helps the statewide elections because it drives up your turnout. And I would just tell you, I've been to over 180 events in the last 2 years around the Commonwealth of Virginia. We put 115,000 miles on the Prius, which is outdoors, for that very reason, to help delegates and senators get reelected, and even to help people in local races to get elected. So it's something we'll continue to do.
At least you've done it with good gas mileage, right?
That's right.
I did promise Pam, and then I promised Aiden, and then we'll come around this way, okay?
Ladies first.
And I drive a Prius. Actually, have two. I'd love to spend an hour with you, just me and you. But let me talk about unfunded mandates as reflected in education and educational issues. We know that the Department of Education, in theory, federal, is supposedly going away, and we've got Betsy DeVos who doesn't know anything about public education. But in Virginia, we have standards of quality. And they are not standards of quality, they are standards of mediocrity. That needs to change. In York County, where I reside, where we are right now, we hire 100 teachers more than required by state law, and we're not unusual. It's unfunded. We have to find a way to pay for it. We're lucky in the sense that York County is a relatively well-to-do community, that we can afford to do it. Some place out at Bedford, they're not, don't have the money to do it. What could you do to bring up those standards for Virginians, to look at unfunded mandates and how they affect the communities, and also vouchers if they go through? How are we going to?
They're not going to go through.
Well,
because we're going to make sure that we change these seats.
I hope so. But the fact of the matter is, with federal funding, we are, can lose our impact aid here. We're a compassionate duty station in York County, which means it's costing us a great deal with children. And with the McKinney-Vento Act, we have a child here in York County, a homeless child, that the parents move to Portsmouth, and we have to provide transportation back and forth from Portsmouth every day for this child. I don't begrudge the child in education by any means, but why are we transporting him back and forth while he could go to school in Portsmouth, but we have to pay for it?
Yes, I hear you loudly and clearly, and I will tell you, I do have an office in Newport News, and I see a lot of school-age children in my practice, and York County has good schools, Poquoson has good schools, and I thank you all for doing what you're doing, because K through 12 public education is the most important thing that we can do for our future and for our children. I sit here and tell you that I'm a product of public schools over on the Eastern Shore, and I wouldn't be sitting here talking to you if I hadn't had access to a world-class education system. So, with that being said, and my wife being a K through 5 elementary teacher, I not only hear it in groups like this, but I hear it when I go home, which is fine. And I just was recently endorsed by the VEA, as you may know, and I work closely with them since I've been in public service for the last 10 years. But just let's start off with this. The average teacher's salary in Virginia is $7,500 less than the national average. So if we're going to recruit and retain teachers, to Virginia. We've got to pay them, and I know, living with Pam, who's a teacher, they do it because they love children, but they also have to pay their bills at the end of the day. So that's the first place to start.
Can I state,
So absolutely.
interrupt you for a second? One of the things we do in government, and I see it other places, but we give percentage raises. And we do the step system here in York County, and every time you give a percentage raise, the steps go out of whack because the person at the top gets a large raise and the person at the bottom gets nothing. I would love to see a dollar amount per teacher or per administrator, whatever, you know. But as a dollar amount, we don't upset, everybody still, if you get $1,500 raise, everybody's still $1,500 apart from each other. And the one at the bottom who needs it the most will get, in a sense, the equivalent of a better raise than the person who's at the top.
Okay.
I'm not saying they don't necessarily need the money, of course, but, you know, you are rewarding longevity, I understand that.
Yeah.
But the problem is, we don't keep our teachers. If we don't reward them at the beginning, we lose them.
No, I agree with you. And let's talk about just a couple other things very briefly, and you mentioned this, but vouchers. Anything that siphons money away from K through 12 education, public education, is going to be a non-starter, and as long as, again, we have Democrats. And the last thing that I want to just tell you, and I think this is important for education, oftentimes in Richmond policy is made, whether it be for education or healthcare or transportation, but it is very, very important that the policymakers communicate with our educators. And that line of communication over the years has not been as good as it should be. So the last thing we should be doing is making policy, and then you come to me and say, Ralph, why did you do that? I've been teaching for however many years. That's not going to help us, or it's going to hurt us. So there needs to be an open line of communication between teachers. Are you a teacher? I take what you seem like you know a lot.
I served on the school board.
All right. So, but anyway, so people that work in the schools, whether they be teachers or whether they work in the cafeteria or school bus drivers, they need to be communicating with the people that are making policy, you know, regarding their day-to-day lives. So again, at the end of the day, if we're going to talk about the importance of the economy, if we're going to talk about the importance of our children as our future, we've got to make K through 12 public education a priority. It's just the way it has to be.
I also say 0 to 5.
Well, we can talk about that too.
Which could be funded. No, just kidding.
We've actually done a lot of work with pre-K education.
It's important because, as you know, that's when the brain's growing.
We've done a lot of work with child care. We've done a lot of work with child nutrition, making sure they're not hungry, children aren't hungry when they go to school, and done a lot of work with
there's no
hunger.
profit in that. Haven't you been listening to the president?
All right, so Eden, and then Chris, I just noticed you were back there probably trying to get me, so I'll get you, I promise.
So my question is for you, bringing it back to healthcare, is as a physician, and with a lot of the complaints people have about their premiums going up under the Affordable Care Act, my personal proposal and my question to you would be, like, how do you feel about, as a way to cut costs for healthcare, is to stop covering unscientific, flat-out pseudoscientific and ineffective treatments like homeopathy, naturopathy, chiropractic, acupuncture, and just everything that falls under the so-called complementary and alternative medicine.
Alternative medicine?
Right.
You know, that's a good question, but let me just tell you that, good question. As a pediatric neurologist, I'll give you an example. I see a lot of children with migraines, and I do a lot of what I call evidence-based medicine, in other words, you know, things that have been studied and there's good data for.
Right.
And I can't fix or help every child that comes through, but I've seen a lot of children go to chiropractors and have good results. I've seen...
Putting them at severe risk.
Hold on a second. I now...
For stroke.
Well...
there's something to be said for the placebo effect for acupuncture.
Well, you seem like you know a lot about it. Yeah. So anyway, so if I can't help someone with evidence-based medicine, and they go to someone down the street who does acupuncture or who is a chiropractor, a lot of people have been helped by those people. So, I agree that what we do and what we pay for in healthcare, that you and I all pay for together, should be evidence-based. So if there's data that an acupuncturist is able to help a group of people with migraines, let's say, or that a chiropractor can help a group, then I think we should still be open-minded. Because I've been in the trenches for 30 years, and to your point, whether it's placebo or whether it's just a different technique or a new promise or the way they present themselves, there are people that are helped. But I don't think things that haven't been proven should be paid for by us. But I would say probably if you look at what's driving the cost of healthcare, there's a couple things. Pharmaceuticals. There's a medicine that I use for a type of seizure that for a low vial that lasts 5 days is $25,000. Now, what person can pay for that? You remember the EpiPens? And so greed is a terrible thing. So we need to work with our pharmaceutical companies toward reform. I pay a lot of money each year in malpractice insurance. So that needs to be addressed. And then I would be, the other thing that's kind of interesting, this is kind of interesting sometimes, what do you think the most expensive piece of technology in healthcare is today, as far as MRI machine? That's what I would probably say. But you know what it is? It's this pen right here in my hand. And so if I order an MRI on everybody that comes in for a headache, or I order this whole laundry list of lab tests, that all drives the cost. So somehow I have to have someone kind of making sure that I'm well educated and making sure that I'm ordering what I need to order and not a bunch of things that aren't necessary. So it's complicated, but the bottom line here is if we put people at the table that understand healthcare, we can come up with a plan. It's not brain surgery. But if we continue to have people like Donald Trump and Paul Ryan who pull up their chair to the table and say that they're going to fix healthcare, we got a problem. So we need to get the politics out of it, put people that know what they're doing at the table, and shut the door and come up with a plan that's good for this country.
Okay, Chris, and then we'll go to Pam. Did you already have one?
No,
Okay, I'm so sorry. All right, I thought you did.
No, I'm between.
That's what's happening. Okay, so Chris and Pam.
You are speaking to a room full of Democrats and Democratic-leaning voters, and everybody in this room is paying close attention and is well informed. I had dinner with my brother-in-law a week ago. He's a business Democrat, and I just thought I'd take the pulse, so to speak, and I said, there's a primary coming up. Who do you like? What do you think about it? And he didn't really quite realize that there was a primary coming up. He said, oh, there's a guy from the Eastern Shore. I like him. What is his name? So we had a little bit of discussion. But my question to you
I'm glad
is...
he didn't say, I hope he goes back to the Eastern Shore.
I think you have a strong supporter there. Assuming you win the Democratic nomination, there are a lot of Virginians who are not paying attention right now. And so my question to you is, when it comes time to the general election, what is the vision that you're going to... We can tell what your vision is here, but when it comes time to communicate to the Virginians who are not yet paying attention, what is your message going to be, and how are you going to communicate it?
Great, and that goes back to what we were talking about with Sam, and we talked about how to get the message out, but let's talk about the message. The message is that I think anybody that wants to lead the Commonwealth of Virginia needs to focus on the economy. So the message is economic opportunity for all Virginians, no matter who you are, no matter where you are. And so there are people like me that have been successful. I had a lot of opportunities, but the plan that helped me is not working for a lot of people in Virginia. It's not working for a lot of minorities. It's not working for women. It's not working for some of the immigrants. So we need to make sure that we level the playing field. And so we need to reach out and make sure that people that it's not working for, that we give them an answer to that and a reason why they should come vote for us. And I think some of it, quite frankly, is going to be that people will realize they've been sold a bill of goods by what they listened to in 2016. And that's not going to happen overnight, but in time. And that, I think some of our messaging will be revolving around that. And then finally, the question is, how do we get it out? The things that I mentioned to her are important. Trump was able to get his message out without really getting on to, you didn't see a lot of TV ads for him. Well, the reason why he had what we call free media, every time he opened his mouth, the media was picking up. We're not going to be able to rely on that in a governor's race. We will somewhat. The press will help out somewhat, but we've got to have the resources that we're able to use. And I hate to admit this, but at the end of the day, most people still watch that black box in the evening, and so that's how they get to know who's running and what they stand for. So, it'll be up to us to have the resources and a good message, and then, get that message out to the people that are then going to vote. But another area I would just mention while we're on that track, an area of Virginia that's still hurting. Our unemployment rate has gone from 5.4 to 3.9. It's nowhere near that on the Eastern Shore, and the South Side, and the Southwest. So how do we help those people? How do we lift all of Virginia up? And there's a couple things. I won't get in. I'll stop here in a second. But there are a couple things that are what I would call low-hanging fruit. One is there are a lot of pockets in rural Virginia that don't have access to broadband. I mean, that's unacceptable in 2017. There are a lot of places that don't have access to cell coverage. Everything I do, I can do on my cell phone, but if I don't have coverage, I'm dead in the water. So we've got to go out and, we've got the Southwest that, the coal industry is not what it should be, or not what it used to be, so we've got to redeploy a lot of those individuals into other means of employment. So I think a lot of it is going out and listening to people and let them know that, that we're there to help them. And what's always frustrated me is that the very people in rural Virginia that we're trying to help with jobs, that we're trying to help with health care, we're trying to help with the opioid crisis, that we're trying to help with access to education, are the people that keep voting for the very individuals that do absolutely nothing for them. As a matter of fact, probably hurt them. And a lot of that's related to what they hear on Fox News. So if you can unplug Fox News, it would be helpful.
All right, Pam. So my question is environmental based. So I wanted to talk about the sort of interesting relationship that states and Virginia is obviously in this situation as well, with our reliance on federal funding for environmental, to fund environmental programs, but also the trade-off to that, to the sense that the federal government has done, and Trump has done in a lot of executive actions, have been rolling back environmental orders that have been put in the Obama administration, and that there's this sense that, well, the states can do it, they all have the authority, they all have the funding, and so there's this sort of pushing back or feeding to the states' rights thinkers. Okay, and the trade-off there is that some of the things that are important in Virginia are interstate-based concerns. So so my question is sort of, what would we do about the funding issue? Lots of folks that actually work in our state agencies their salaries are literally from federal funding.
You're right.
And then the programs that support that is from federal funding. And then the trade-off being that Virginia is in the airshed that's downstream from power plants in the Midwest, and we're in an interstate cooperative with the Chesapeake Bay for our fisheries and offshore, and so those are sort of things that can't be explicitly handled at the state level. So what do we do about
Wow, that's a great question. Let me make a couple points. I'll start with sea level rise. And that's something I introduced legislation, I guess 4 or 5 years ago when I was in the Senate, to study that. We had to study it in order to apply for federal grants. And so we've gone through that process, and now we've received some federal money, and that's to deal with sea level rise. And the reason why that was important, Virginia nor cities in Hampton Roads, like Norfolk and Virginia, they don't have the resources to deal with what we have to do to be resilient with sea level rise. So if that money gets dried up, where are we? Second thing I would say is that offshore drilling. I've been the only statewide elected official to advocate against offshore drilling, and a lot of that stems from science and where I grew up. And now that Mr. Trump is our president, he said he's going to reverse that and look at offshore drilling, which I tremendously regret. The last point I want to make, we have made so many gains on restoring the health of the Chesapeake Bay, and we still have a lot of work to do, but now his budget threatens to take $73 million that we use for bay cleanup. And a lot of people say, well, what is that used for? Let me give you an example of what it's used for. I grew up on the Eastern Shore on Nancock Creek, and for years we had an outdated septic system, sewer system, that was literally dumping raw sewage into a Nancock Creek that then went into the bay with nitrogen and phosphorus. And so the only way that we could update that is, as you might imagine, it's very expensive. But Nancock, I can promise you, with its 600 residents, they couldn't pay for that. So we relied on federal funding. That's what those things are for. And so if he pulls all of that away, we're going to have to be in a position, and it's going to be a difficult position, where we have to do more with less. But again, it's going to take people at the table that understand the way things work and try to counter some of the last thing that we want to do is go backward on a lot of these issues. So it's a tremendous concern that we have. And there's a lot of other examples too. I mean, you talk about federal workers. I mean, you could go on and on. He's trying to take everything away from the federal government and dump it into the states to include health care, which is what we were talking about earlier. So we're in a very vulnerable position.
All right, we have a time check.
6:07.
So we should wrap it up.
Mark did.
Yeah, let's let Mark have our last question.
The lawyer needs to argue.
Hey, you get closing arguments, counsel.
I don't know if I can turn 3 questions into 1 question.
A classic lawyer, right?
One thing is just
Is this going to be a deposition?
well, you mentioned gerrymandering, and that's an interesting issue. But with people listening to you and your points on issues, how do you distinguish yourself from Tom Farrell, another candidate for governor?
Yeah. First of all, let me say that public servant, he was a U.S. congressman, and I think the best thing that we could do as Democrats is have a very positive and civil campaign and election, because after June the 13th, we're all going to have to come together and be under one tent and beat whoever we're running against. So I would just tell you, there are some things, if you look at our records, that I think you could contrast. But the most important thing is that I've been in Virginia politics for 10 years.
Students do a hypothetical gubernatorial race campaign strategy meant by plans using you and Mr. Gillespie.
Right.
And they have come up with many great campaign slogans for you over time. So if you ever need some ideas, you let me know.
I'd like to hear those.
I've got some, I have them making like fake direct mailers. But the first semester one that I got is still my personal favorite. Now it's a little trademark problem, so you probably can't use it, but I swore to the maker, should I ever have occasion to meet you, that I would pass her hard work on to you. And so I'm going to do that right now by gifting you with this fabulous Virginia is for Northam.
I like that.
Yeah, beautiful campaign slogan. You can take that with you. Stick that in the back of the
Can I just say, thank you all. This is what it's all about, is having people, and you all are very well informed, and it takes people like you to have discussions like this and then take that message out and talk to people and let them know what we're trying to do across this Commonwealth, and again, let them know how important it is to go vote on election day. So thank you all for allowing me to be here, and thanks for your all's input. I appreciate it.
And the hard work of the organizers, really good about it.
Yes, you're here.
Main event starts in 20 minutes, so.
Yes, and we have the organizers want to make sure that everybody here today suffered through low blood sugar. So we have some Subway sandwiches and
That's very nice. All right, thank you all for watching.